Good afternoon, everyone. First, giving honor to the chair of this committee, Assembly Lady Peoples, Senator Gallivan, Kennedy, and Assembly Kearns. First of all, thank you for the opportunity to discuss this very important issue on behalf of CSCA. My name is Robert Mootry. I'm the Regional Director of CSCA, responsible for Erie County and the surrounding 14 counties. I kind of bring a different take to this whole issue because I have previously worked at Buffalo Psychiatric Center for 21 years. I started my career in Office of OMRDD in the late 70s, and I worked at West Seneca for 7 years. So I have always been an advocate of individuals with disabilities. And I take that very seriously. But I'm also a spokesman for people who don't have a voice, and I'm willing to speak up for those issues. Transferring children's CPC to the grounds of Buffalo Psychiatric Center. I worked at the Psychiatric Center as a secure care therapy aide, and then also as a mental health therapy aide. So I work with the most challenging individuals at the facility for a number of years. Buffalo Psychiatric Center, and I want to put this on record, does an excellent job. Excellent job. The staff do an excellent job. And they had a motto, hope for recovery. But putting children in the same building doesn't make sense. It doesn't make common sense. And sometimes common sense is not common. But when you're dealing with co-mingling children, the problem is, you know, they're still going to be on the grounds with adults. You're transferring them from a facility where they had a lot of freedom, a lot of access to a more secure setting, and where they're going to be limited on where they can go and what they can do. Over the last, 7, 8 years, OMH has continually downsized, and it boils down to dollars and cents. It doesn't take in consideration of the families that they represent. I mean, those families with those children coming from Children's Psychiatric Center, it just doesn't make sense. So, and I'm kind of just breezing over my testimony, but I'm going to read the last page. The continuing efforts to close Children's Psychiatric Center stems from OMH's inconsistency on reducing the number of remaining psychiatric centers due to the cost of inpatient care, regardless of the impact on the family. I don't want to say regardless of the impact on the families. The legislature should consider the drastic cutbacks at the state level over the past 7 years. There's been a push towards bare-bones state operation in recent years, and all levels of government are being forced to cut staff and services and operate under a zero-growth budget. And we have seen that at the Psychiatric Center with the increase in costs on overtime. You have a number of staff that are working mandatory overtime on a consistent basis. And when you're dealing with human lives, it plays an important part. So we at CSCA, we urge you to find other ways of disinvesting in a commitment to our most vulnerable population. With a number of tragic events that occurred across the country over the past years, individuals involved in untreated psychiatric illnesses, now is not the time to reduce state financial and moral responsibility to the most vulnerable. We stand ready to work with you to keep children's CPC open. Thank you.